Hello everyone, welcome to an MWG Senior Services presentation on Obamacare and the impacts it's having on Medicare. Today we're going to be talking about how to prepare for the changes that are coming with the Independent Advisory Board and different things that are coming in the next few years. It's just good to be prepared and know kind of what will be happening and taking place and kind of what you can do to protect yourself to the best of your ability. So again, this is the MWG Senior Services presentation. We hope you enjoy. All right, first thing we're going to do is we know everyone has heard different things in the news, talking about the Obamacare cut, $716 billion for Medicare, and the Medicare Advantage plan cuts, and all the different things out there that people are hearing. And as you can see on the screen right now, these are just a few of the articles that people have been seeing over the past few years. And what we're going to do today is hopefully be able to shed some light on how Obamacare is going to impact Medicare. First thing you need to know is Medicare in general is not changing over a ton, or hasn't changed over a ton as of right now. This is 2014. Your Medicare supplement plans have not changed. They are still the same. Medicare Advantage plans, they change each year. They always have. We'll get into that more in a minute. Your Part D prescription drug coverage has changed a little bit, but it's changed for the better. But let's start with Medicare supplement plans and kind of go into a little bit more detail on them. These plans still can ask health questions. A lot of people thought with the Obamacare going into effect, also known as the Affordable Care Act, that these plans would not be asking health questions after 2014. Well, they still can because they are not primary coverage. Your Medicare is your primary coverage. This is secondary coverage or supplemental insurance. So just want to let you know that. There are not extra penalties or taxes placed on Medicare supplement plans as of 2014. The Independent Advisory Board may change this, but as of right now, there has been no taxes or no high-income earner penalties on Medicare supplement plans. As of 2014, Medicare is not being replaced by the Affordable Care Act. That means that Medicare Parts A, Part B, Part C, and Part D are still all in place. Medicare has a chance to become stronger due to this because a lot of people kind of being pushed in with the Affordable Care Act to kind of all insurers across the country could help level out some costs. That's not a guarantee. As of right now, you can still see the same doctors and use the same hospitals because cuts have not gone into effect with hospitals and doctors as of this point. So again, as of 2014, it's still the same Medicare that you have been used to. How may some other things change? People are going to be paying more for prescription drug costs. This has been into effect for several years since Obamacare took effect. We have seen a higher income penalty on Part D and Part B. So those who are single starting at $88,000 and those married couples $170,000 and above will have penalties on their Part B and Part D. Those levels are set to stay the same until 2020. But it could change after 2020. I guess the income could drop or it could increase. It could stay the same if they could choose to extend it. The donut hole, which everyone who has Part D is kind of familiar with this, but it's the gap in prescription drug coverage. It will be closed by 2020, and it's closing a little bit each year. If you're on Part D currently, you probably already noticed that you're paying less than 50% of your drug costs during the donut hole, unless it's a generic. In a generic case, you're still paying roughly 87%, but those are cheaper drugs in general most of the time. And as I mentioned this already. Next, go to Medicare Advantage plans. These were originally going to be cut, but however, with 14 million people in Medicare Advantage plans across the country, that was changed a little bit, and they pulled back these cuts. So, that was part of what the whole Affordable Care Act was based on. Medicare had over $500 billion in cuts that were going to be helping fund the Affordable Care Act. 200-something million, or 270, I believe, was what was supposed to be going to the Medicare Advantage plans, but that got changed. So I don't know where that funding is going to come from, but we could see that at a later time in Medicare when the Independent Advisory Board comes into play. These plans are going to be functioning the same manner. They do not have high income penalties. Basically, Medicare Advantage plans take over your Medicare Part A and Part B and are run by private insurance companies like Humana, United Healthcare, AARP, You've seen them in the marketplace. Windsor, different companies of this nature. A lot of the Blue Shields and Blue Cross Blue Shields across the country offer these plans as well. Independent Payment Advisory Board. This board is going to be set up to give recommendations for cuts in 2015 to Medicare. Medicare is not a profitable company. It's not supposed to be profitable, but it is supposed to be breaking even, and it's not come close to breaking even in a long, long time. So what they're doing now is they're setting up a board that will be, okay, what do we need to cut doctors' pay? Do we need to cut the amount of coverage we're offering? Do we need to charge higher premiums? What are we? Most likely they'll be charging some higher premiums, and most likely they'll be giving some benefit cuts. I can see both go in together. Also, that can end up changing Medicare supplement plans, how they are offered in the future. Definitely will change Medicare Advantage plans because they're based off Medicare coverage as well. Their decisions automatically take effect unless a counteracted measure by Congress, and there must be a supermajority or a 3/5 vote in the U.S. Senate. That means 60% of the Senate has to vote to decline that advisory board's decision to decline or to make null and void whatever they recommend. That Congress and Obama at this point agrees that this will not affect the coverage or cause the quality of care to diminish. You just don't know. I mean, that basically comes down to we don't know what they're going to advise. How can you say that you don't think it will affect something? We've already seen some different things that have kind of been in place that got changed and switched because they were negative. Could be that that's what happens here, but this is something that is coming in 2015, and by 2017, their decisions will automatically take place unless 60% of the U.S. Senate votes against it. How can you protect yourself? You need to contact MWG Senior Services. We have ways to compare Medicare supplement plans, Part D plans. We can look them all up, provide a detailed analysis. But in the big scheme of things, there's no difference between the Medicare supplement that we can offer with Mutual of Omaha and what another agent with Mutual of Omaha can offer, or Blue Cross Blue Shield, or whatever carrier it may be. We have over 30 Medicare supplement carriers and over 1,000 Medicare supplement plans across the country. We can help you with this, and we can provide you with the best service available. We can also help you with a prescription drug plan analysis annually, which on average saves the average Medicare beneficiary over $800 a year. That's great news. We also provide you with a monthly update on Obamacare, Medicare, healthcare in general, just letting you know what's going on. And we have certified agents who are here to help you with all of your Medicare questions. We're here. We're unlike a lot of agents. We're not out in the field. We do all of our stuff by phone. So we're here to help you during the day. If your agent is busy, it automatically goes to one of our ladies here, not to a voicemail, that can help you with any questions until they can get back with you. So that's what we're here for. We look forward to helping you. Please feel free to give us a call at 877-936-2991. Again, that's 877-936-2991. Or you can reach us at www.medicareinsuranceFinders.com. Thank you very much.